All right, everybody. Well, good evening and welcome. We're so happy to have you all here with us this evening. Looks like we have some attendees already in the room, and we have some other folks who will be joining us as we go. My name is Matthew Hughes. I'm the Executive Director of the International Relations Council in Kansas City. And I'm just remembering back to a little over a month ago, we were at the KC Chamber boardroom in Union Station having a conversation about coronavirus and what that meant and what we were looking at. And then all of a sudden, our world changed in all sorts of ways that I'm sure we'll get into tonight. So it is a great pleasure to have all of you here and to have our distinguished panel as well. Thank you for being here. The International Relations Council, as you may know, is a Kansas City organization. We talk about what's going on around the world, how it connects to our community here. And at the moment, we can think of no more pressing issue that connects from the world to our community than COVID-19 and the public health response that we're all experiencing at the moment. We do have a variety of other programs that are coming up. We encourage you to check out our website at irckc.org for that full calendar. We got a whole range of different digital options that have been going on, so we hope that you can join us for those. It is also our pleasure to work with a range of community partners for these programs. And tonight, it's our privilege to be working with the World Trade Center, Kansas City, represented this evening by Caitlin Bast. Caitlin?
Thank you, Matthew. It's great to be here, and I want to thank the panelists and Matthew for co-hosting this. I'm Caitlin Bast. I'm the manager of the World Trade Center alongside my counterpart, Melissa Miller. We are a part of the Greater Kansas City Chamber of Commerce, so we do anything international. However, the coronavirus is both international and domestic, so it's all the chamber's focused on right now is supporting the business community. Again, I just want to thank Matthew and the IRC for a great partnership. I too was reflecting on the event we put on, I guess, just over a month ago, and how quickly the situation has evolved. So we're just really lucky to have these panelists to help kind of fill in some of the gaps on why we are where we are with public health infrastructure and where we're going. So without any more words, I'll pass it over to Mary Sanchez to introduce herself and the panelists.
Wonderful. Thank you so much, Caitlin and Matthew. You know, actually, I almost feel like I have to echo that because I moderated that session down at the chamber boardroom. It's almost surreal, and I think that's the way a lot of people are feeling right now. So much has happened so quickly, both in our professional and our personal lives. You know, even the fact that we're doing this by Zoom, obviously from all of our own homes, tells us everything. It's just a whole different world. However, our panels tonight are very much, you know, their professional lives have been placed partly, you know, into this space because this is their world. You know, they're experts in this field. There are many questions that we can have answered tonight just to get a perspective on things. What we're kind of hoping to do is that we almost just have a conversation amongst our three panelists because I said this, you know, they are very knowledgeable in their own right, and we kind of just want to hear everything that they know. So let's just start with what we're calling this. It is supplying and sustaining a prepared public health infrastructure. And what we want to go over is kind of from a global context where everything lies with COVID-19, and then also just kind of to pare it down more to our local and this regional level, because I do think there are a lot of things that are unique about the Midwest. Number one, our agriculture, our bi-state system, all sorts of things can come into play there. So let's go ahead and introduce people. Why don't we start with Cody Wood? He's with Dentons Law Firm. And let's see, why don't you just tell us a little bit more about yourself and the work that you do, and then we'll go around to the other panelists.
Yeah, for sure. So thanks, Mary. It's good to be with you all here this evening. My name is Cody Wood. I'm an associate at Dentons here in our Kansas City office. Dentons is the world's largest law firm. So we have offices on every continent except Antarctica, in almost every major market. And if we're not there now, we'll probably be there in the next couple of years. And I think over 1,100 lawyers just in the United States alone. So we work a lot with the World Trade Center, actually, supporting their mission, and we learn a lot from them as well. So it's great for Caitlin and Melissa to invite us here today to participate. And thanks to the IRC, I've been to some of your programs as well, and they're always very informative and educational. So my practice area focuses on international trade. a lot of import compliance work, customs compliance, free trade agreements, policy advising. So I've been helping companies basically since I started at Dentons 2.5 years ago understand the rapidly evolving trade regimes that have come about just in the last couple of years.
Okay, great. Thank you. Yeah, you know, I keep running into Dentons again and again. Anytime that I touch anything with a global context, the law firm comes up. It's one of those resources that, frankly, I think a lot of Kansas Cityans don't realize is here. So this is wonderful that we've got you on the panel. Next, I wanted to introduce Dr. Faisal Khan. He is the CEO of the Samuel U. Rodgers Health Center, which a lot of people know in Kansas City. He's a public health expert and a medical epidemiologist. So Dr. Khan, can you tell us a little bit more about yourself?
Sure, thank you. My name is Faisal Khan. I'm a medical epidemiologist, and I trained in infectious diseases as a physician. I've worked in public health for the last 25 years, including HIV, AIDS, and tuberculosis in a number of settings, including Australia, Vietnam, South Africa, Pakistan, and Malaysia. I have been the CEO of the Samuel Rodgers Health Center since October 2018, but prior to that, I was director of the St. Louis County Department of Public Health for 6 years, and I wrote their pandemic response plan, the one that they're following right now. Obviously, with a background in public health, it comes in handy when dealing with healthcare operations in the greater Kansas City area. I'm delighted to be part of this panel.
Thank you. Thank you very much. Okay, and next, but not final, we'll have Raj Bhala. He is a law professor at the University of Kansas, and also is it Brenneisen? Is that what you say? Brenneisen Distinguished Law Professor there as well.
I teach international trade law and advanced international trade law at KU Law School. I work with Dentons and specifically with Cody on international trade matters. And I write a column for Bloomberg, specifically Bloomberg Quint, based in Mumbai, on international law and economics.
Wonderful. Okay. Well, let's just start with the aspect of public health. I know this is a little bit the very beginning and cursory, but can someone just kind of jump in terms of, like how they view what public health is and where the general public does? Because sometimes I find that people are almost questioning what is public health in like a global context, in a, individual context. Someone. Dr. Khan, you want to?
Sure, I'll take a stab at it, and I will put it in a limerick back to you in the audience, to rephrase an old limerick that I've seen in physicians' offices. God and public health, everyone adores when sickness returns and not before. When health returns and things are righted, God is forgotten and public health slighted. Unfortunately, that is the story of public health. Public health pertains to each and every aspect of our lives, if you think about it. One of the most empirical things that most public health students learn about is the very definition of health. Health is a state of complete physical, social, mental, and emotional well-being, and not merely the absence of disease and infirmity. That, believe it or not, is the definition of health. And if you think about it, it is a pretty comprehensive definition, because those four conditions, complete physical, mental, social, and emotional health, almost never exist in ideal form in any individual or population or subpopulation or community. And so it touches every aspect of our lives on a daily basis. In a situation such as a pandemic, it exposes the very vulnerabilities pertaining to determination of health status indicators that we take for granted on any other day. Things such as transportation, things such as access to healthcare, affordability of nutritious food, access to such food, things such as residential security and avoidance of homelessness or a loss of income, and how that can be detrimental to generations in terms of their healthcare status. In the United States, as a case in point, today the zip code of your birth determines how long you will live, and what quality of life you will have. Just think about that for a moment. Public health encompasses everything that touches you. In fact, only 20%, if that, of your health status is determined by clinical care. The other 80% comes from everything else that you could possibly make a list of. And public health includes all of those.
You know, it's fascinating you say that because frankly, I hear a lot of pushback from, frankly, readers sometimes, and maybe it's the way I write certain columns, but on that concept, they want to believe that they're more in control of their own destiny than perhaps what you've just stated. Is that, you know, part of what we're dealing with right now is that everyone's worlds are a little bit turned upside down, you know, partly because we think that these things, we're used to being there. I'm used to being able to get in my car, drive to the grocery, have toilet paper available, or, you know, God forbid, not having food. So is that part of what we're dealing with now? Is there something about that that someone else can jump in on?
Yeah.
Please go ahead.
Well, I was just going to say, from the sort of comprehensive viewpoint that Dr. Khan laid out, it's definitely not only realizing the lack of control that we have over our own lives based on events, but how much of our lives rely on the actions of others, in terms of just moving things from point A to point B. It's an incredibly complex network and ecosystem of interactions that can be disrupted based on, you know, someone getting sick and then not being able to show up for work. And then that just cascades down and down the supply chain until pretty soon you're not seeing the part that you need for the ventilator that's supposed to keep you alive. And so it's not necessarily just the fact that, you know, we don't have access to the things that we need, but we need to broaden our vision and note that we're much more reliant on other people across the world.
And picking up on what Cody and Dr. Khan said, I think for most of the post-Second World War era, the American public and the European public bought into the idea that their public health, the way Dr. Khan very nicely defined it, would be enhanced by closer trade relations, by free trade. That if we had interdependent supply chains, the very way that the European Union set up based on the steel and coal community, if we did that in our public health, we would all be better off. And as other countries joined into the world trading system, post-colonial countries, India, Pakistan, their public health would be enhanced by being part of these supply chains. That consensus has sharply eroded. And the pendulum is very much swung, and it started swinging before the COVID crisis because of reasons of exacerbated inequality. The points that Dr. Khan meant that actually people were starting to think that, well, actually through free trade, we're made worse off. We're less equal. We're more poor. And our public health is deteriorated. And our income Gini coefficients are getting worse. Well, likewise now with the COVID crisis, that sentiment that we're not better off being closer together, but rather we should separate and have our own independent supply chains, not only at a national level, but look at what Governor Cuomo has said. We need made in New York. We can't rely on other states. So I would, absolutely agree that we are now in this paradigm shift.
Sure. Can someone speak to maybe what was you started, just kind of draw the full picture. What were the arguments that were going on at the time that pushed the idea of being more global commerce? Who or what was pushing that argument and how was that bought? And then at what point did things start to kind of dissipate? I mean, I know I wrote a lot about NAFTA, and that was very, very, very strong, the pushback against that. Or even here, you want to talk Kansas City, Smartport. There were I wrote numerous columns about a lot of conspiracy theories about what was going on over there. Someone, I don't know if Cody, Raj, any?
Yeah, well, so in terms of when sort of global trade began, it was after World War II, was really when it sort of started to pick up, and we realized that we need stronger multilateral institutions to make sure countries are cooperating with each other rather than fighting each other. And so we saw the birth of the rules-based trading system under the GATT, and it is evolved from there. And I think to your point about when we've seen the shift, it's really difficult because in the last 3-4 years, the position has just taken such a rapid 180, sort of since since we've been pursuing this multilateral free trade system. And a lot of that, I think, has to do with the fact that domestic manufacturing in the United States, after the rise of China and the entry of China in the WTO, has really declined rapidly. And their lack of social mobility and the lack of labor opportunities for folks to move into new sectors of the economy has created a more populist backlash that we've just now seen capitalized on in the most recent election. And as to Raj's point, that's being exacerbated even further now by this sort of new protectionist measure, not protectionist in terms of protecting jobs, but protection in terms of taking steps that we need to take to protect our public health.
Absolutely. Did someone want to add more on that, or should we?
If I could just add briefly to that, I completely agree. What worries me most, and I think I speak for a lot of public health professionals as well, is that this sense of isolationism that seems to be taking root in the present period is detrimental to the cause of public health, not just in the United States, but globally. It weakens our overall capacity to deal with threats such as pandemics and other emerging infectious diseases, or frankly, the dual burden of chronic disease and infectious disease that so many developing countries and developed countries are dealing with. And so to that extent, separating ourselves from the global supply chain or manufacturing chain really poses a huge threat to public health cooperation. The administration's recent decision to defund the World Health Organization, for example, or threaten to do so, does not make America or Americans safer or healthier in any form or manner. In fact, it weakens the global response to the pandemic and future pandemics to follow, which are almost certain to happen at some point in the future. We have been very, very fortunate in the last 20 years. We have dodged a couple of bullets with SARS, with MERS, with even with Ebola, frankly, all different diseases. But I think SARS was the closest that came to mimicking what we're seeing now. And we were very fortunate that it petered out on its own. But it challenged public health in a major way, and we were found wanting for resources. I'll leave it at that.
Is some of what's going on, though, and I'm thinking in terms of within the general public's view of things and how they might affect this, by buying habits or by politics. I don't want to go too far down that trail, but, is it kind of the inability to see the interrelatedness of public health and then also the economy? Because, let's take one issue. We'll do like face masks and, parts, ventilator parts, and maybe that's what Cody and Raj can get into a little bit more in terms of now, I think the idea is, oh my gosh, we really need to be making all of these here. That the problem is now we depend on China to be sending us the face masks. And, Wuhan is where this first came out of. So there's kind of that clash that's going on.
Well, I mean, let me put it out as a proposition for everyone's consideration, and that is, that the behavior of China in this crisis in particular, the alleged behavior of the Communist Party, has turned the what has been a public health crisis into a national security argument. In other words, the presumption when China joined the World Trade Organization in 2001 was that it would be a good actor in world trade and that it would play by the rules, which include transparency. They include commitments on sanitary and phytosanitary standards, and they include very strong disciplines against export restraints. With all that we have heard in the news about the behavior of the Chinese government, there's an understandable concern in India, in the European Union, in the United States, that the supply chains out of China cannot be trusted. Even India has said that, look, we're dependent for about 80% of our active pharmaceutical ingredients on China. And we, in turn, in the US are dependent for about 80% of our medicines on India. So I think there's a loss of trust, which is probably the most fundamental value on which the international trading system operates in order to provide Dr. Khan and his colleagues with the materials they need to do their work.
Yeah, and to echo that point, and also to dovetail off of Dr. Khan's point, when he was raising the issue about the administration defunding the WHO, it made me think about the steps that the administration has taken to really hamper the work of the WTO, the World Trade Organization. And trust was the first thing that I thought of as well in my mind. Was global cooperation requires a multilateral forum where you can discuss and enforce an open rules-based system. And the administration has not done any favors to that regime. And so it's making it more difficult, not only on a crisis communication level, dealing on the pandemic response side of things, it's making it very hard to coordinate and engage a coalition of the willing to make sure that we all don't, as a nation and as a global cosmopolitan society, go backwards and retrench into our own little territories. And that's a big issue, I think, that is going to come to the forum as well.
Absolutely. Well, so what is the answer? And I think that those are some really good examples, because obviously the pharmaceuticals, that came up very early because people saw that those supply chains were so directly tied to China. So what do you do at this point? What are the things that the companies that you're working with, Cody, are dealing with? And Dr. Khan, I'm sure you see it at the hospital end of what we're worried about now is what you can't get hold of in terms of the pharmaceuticals.
Yeah.
Go ahead, please.
Okay, thank you. So we've been seeing companies run the whole gambit of, we're looking to start up a brand new company to manufacture N95 masks, or we're looking to start a company to, clean and sanitize equipment. We have clients that aren't really in the medical manufacturing space or the medical processing space or healthcare space at all, but they still, based on their operation of manufacturing plants, they still need to be able to obtain N95 masks. And so they have internal issues about how they can move those according to government regulations that come out. So there's a lot that we're trying to do from a client-facing perspective to just basically, it's the same thing you do with any company that's trying to start up and manufacture equipment. You look at all the applicable regulations, tell them this is how you need to structure your business and go. It's just that the sense of urgency is a lot faster. What the government has been trying to do from at least a trade perspective and a regulatory perspective is reduce the friction for goods entering into the United States. And by that, I mean, they've created a more streamlined process for the clearance of personal protective equipment or medical devices that would normally be regulated by the FDA, so you don't have to file as much paperwork. They've created new hubs for direct immediate action response teams from customs or FDA officials. If your shipment's stuck in ports or something like that, stuck in a port, you can go to them. And these are all little half measures that they've taken, but it's really not designed to increase the supply or in terms of increasing manufacturing capacity, it's being able to get things into the United States quicker. There's also been moves to reduce tariffs on certain medical equipment that is imported from China, or parts that were imported from China. So this was a huge issue that affects a lot of industries, and I won't go into all of it if you're not familiar, but the administration has levied 25% tariffs or 15% tariffs on $500 billion worth of products exported from China to the United States every year. A lot of those products include medical devices or parts used in medical devices, or things like personal protective equipment, tongue depressors, wound applicators. And so a lot of medical supply companies reduced their inventory volumes to not pay the higher tariff so that the margins look better on their business. And so that created a real supply glut. And so the administration has sort of opened up a new process to reduce tariffs on those very quickly, ideally, so that companies have more cash flow to bring these products in.
Okay. So who was, I always kind of try and look to who was giving the warning signals ahead of time. I mean, are there certain groups, companies, voices that we weren't listening to that maybe we could have learned from and not been in this crunch? I mean, there's a certain aspect, some of this is that, it's a health thing, you get sick. But, how can we be better prepared even for some of those? It sounds like, what Cody was just describing is very much how we have fixed a somewhat broken system, or one that was a little bit, it was fractured enough that it had some issues where this could get in.
I think we weren't listening to Dr. Khan and they were telling us, giving warning signs, and he can speak much better when he mentioned Ebola and SARS and MERS. Now I think you'll see he and his colleagues at the trade negotiating table as they should be.
Thank you. I appreciate that. But yeah, conspiracy theories aside, the World Health Organization, really did not deserve a lot of the criticism that's being leveled its way, because it's not a regulatory authority or an inspection authority or an enforcement authority. Its enforcement function is virtually non-existent. It's an advisory body, and it's composed of some of the most brilliant minds in the world, regardless of the background of the elected head, because that's always politics and nation blocks and continents coming together to say, no, we want this guy or this person to be the head of the WHO for the next 5 years. The fact is that the WHO raised that alarm in late December after receiving reports coming out of China about a new outbreak of respiratory disease in Wuhan. And the Chinese authorities had by that time tried to act and finally tried to do something concrete about it and began reporting. Now, whether or not that was timely is a debate that will go on for some time. We won't find out about it for at least some more years to come. But the fact is that the world received an early warning, about as early as we possibly could. We could not have had this warning 6 months ago or 8 months ago or even a year ago. That is what it was. But the fact is that all of January and most of February were then wasted in political waffling and grandstanding and all kinds of nonsense, not just in the United States, but in many parts of Europe and the rest of the world as well. Britain is a classic example. Britain has a universal healthcare system. The NHS is very robust, despite all the criticisms it faces. But the fact is that the government in Britain made the same mistake. They didn't act as soon as they should have. Italy is a case in point. They waited, and then when they began to act, it was like chasing the dragon's tail from that point onwards. The United States had a very narrow window of opportunity, about 2.5 weeks, in which a swift ramping up of preventive measures could have avoided the worst case outcomes, the ones that we see playing out in New York State and New York City in particular. That did not happen, and now we are also chasing the tail of this dragon as it will.
Very scary. One of the things I wanted to tell our listeners is that we are taking questions. If you want to submit them, I'm going to try and look at one here. It's from Michael. Let's see. If there is one upside to the pandemic, it could be that it has underscored the great disparities in health status and the social determinants of health among populations in the US. That's actually one that I've written on, and frankly, I can tell you, trying to get that off there. There we go. A lot of pushback to that, but does someone want to take on that? I think that is probably directed more to Dr. Khan, but I think it, you all have a role in that as well.
So, the social determinants of health essentially include all the things that we referred to earlier: transportation, lack of access to care, food, safety and security, a lack of access to clinical care when you need it in an affordable and accessible manner. Add to that generational poverty as a barrier on top of it, as well as the vicious cycle of ill health that usually follows generational poverty. And what you have is a cauldron where you create segments of the population that are vulnerable to pretty much any disease or determinant of health, whether it's chronic or infectious. And so we see that played out in all metro areas, as well as many swaths of rural areas across the United States. Kansas City is no different. Not surprisingly, some of the most terrible burden of disease is being borne by the most vulnerable, the minority population, the African-American population, and the Hispanic population in town. On top of everything else, they now have to deal with an infectious disease without having to have access to resources that the rest of us would take for granted. And so, yes, this has highlighted yet again this great disparity in the haves and between the haves and the have-nots in the United States, particularly in urban areas, more so in cities like Kansas City, which have a rich history of segregation and everything else that followed on top of that. And so St. Louis is no different, and Baltimore and Detroit and Chicago are no different. So we will have to look at studies, years from now to get a true measure of what this has done to the fabric of society and what this has added to the plate of individuals that really have no space left on it. I'll give you one specific example. More than 40% of the kids in the Kansas City public school district are housing insecure. They change schools once or twice during the school year, not because they want to, but because their parents are being evicted or they simply don't have a regular place to stay. Most of these kids, and it is a 100% free and subsidized school lunch district too. So one of the greatest challenges that Dr. Bedell and his team are facing in the Kansas City public schools is, how do we feed these kids when they're supposed to be home and have online schooling? Many of them don't have access to internet. And so all of those challenges are being highlighted. At my end, we're trying to figure out how to get healthcare services and well child checks to these kids in the safety and security of their own home, because they need to catch up on immunizations and well child checks to be ready for the next school year. Otherwise, you're going to have a population of kids vulnerable to outbreaks of infectious diseases like measles and mumps and rubella and everything else.
Kind of the connectedness. One of the things, even to feed off of how that question was written, is I wonder, it said one of the upsides, and the fact that so many people have been affected, and we've seen our elderly deeply, deeply affected, as well as Native American, Latino, African American communities disproportionately. But I wonder if, because some of it is a little bit spread out, and the great fear now for, I think, a lot of portions in the Midwest is what might happen within rural communities where we have, a lack of access as well to healthcare because of closed hospital systems. Is that something that we can build from, almost this shared, unfortunately, pain and death?
Let me try that from this sort of almost theoretical angle. I would say no, unless the country engages in a very serious debate about the proper role of government. We saw this debate a little bit about a month ago when states and localities started to consider whether or not to order a shutdown or a lockdown or stay in place. And you had some officials saying it's a matter of individual responsibility. And you had other officials saying it's actually government responsibility. And I think back to some of the classics that we all read, like even the so-called conservative classics of John Locke about what is the role of government. And if it's not public health, then what is it, other than national defense? So if we're going to expect that rural Kansans or rural Missourians are going to benefit from this crisis through improved public health delivery systems, any more than we're going to expect them to get high-speed internet, we're going to have to understand that the market is not the solution here. It's not you can just do this on your own and expect private sector investment. There has to be, at a minimum, public-private partnerships, if not more government intervention. And just to conclude the point, at the federal level, the Trump administration seems to have acknowledged that in a small way, at least, because they've invoked the Defense Production Act of 1950, which is one of the most interventionist laws you can imagine. It authorizes the government to break private sector contracts and redirect necessary items for uses that the president decides. And we do use it in defense procurement pretty often, but we really haven't used it in crises since the Korean War. So that might, if we trigger this broader debate and sort of get off the individual responsibility, radical free market view, that might be helpful.
Okay, thank you. Yeah, Cody, did you have something to add to that in terms of the trade?
Well, I was just going to add one thing in terms of, it's unfortunate to admit, but the focus, just reading the news every day on what's happening in your own locality, in your own state, sort of makes you forget about, this is a global pandemic. And when we're thinking about people who are on the margins, it's important to recognize that there are additional sort of factors that I don't see or come into contact with on a daily basis. And so I was just reading earlier today that India right now is facing the largest mass migration that it's faced since partition, as I think something like 500,000 workers are moving from the cities back home to their rural communities because there's just no work for them anymore. And not only is there no work, there's barely any food. And so when we're keeping tabs on sort of the global pulse and what's going to be the role of government, not only in intervening in the domestic health, what's going to be the role of government and institutions internationally when a lot of these more low-level social crises build up into broader conflagrations. So, you think about countries that also are facing government instability already, like Venezuela, Sudan, and Nigeria, Yemen. These are all countries that are facing massive crises, not just in dealing with the COVID-19 effects of the disease itself, but the effects on its population in terms of food scarcity, economic scarcity, social instability, and that those aftershocks we're definitely going to feel in the future.
Thank you. Yeah, that's one of the things that I think is often misunderstood. So that's a very, very good point in that, it's easy to look at, where our own lives are, and we're, for decent reasons need to look at our own families and our own health and welfare. But we do often miss that global context. And I know that in some ways, the world is more peaceful than it has ever been before in some ways, but yet global migration, people who are not, in their own home country or where they want to be, is greater than it has ever been since the world wars. And I think that is a huge portion of this, and it's a huge part of the upheaval that then a system that isn't well structured only gets exacerbated by. Dr. Khan, I think you were going to add something.
I was just going to add, one of the things that existed pre-pandemic was that rural hospitals have been closing at an alarming rate in the United States. In Missouri alone, I think the number, the last time I checked, was about 12 or 13 that closed in 2018 to 2019 alone. And so in large parts of our state here in Missouri, the rural populations really have no access to primary care services or emergency room services. They often have to drive 150 miles one way to see a physician. Some of the federally qualified health centers, our counterparts located in rural areas, are struggling to cope with that demand. And now with the pandemic having hit them hard financially, they have also had to make some very harsh decisions about personnel. And so there is a crisis brewing as far as rural healthcare in America is concerned. It's not just the urban areas that are desperately in need.
Thank you. Yeah, I think that's important to point out, definitely.
Could I make a follow-on economic point about it? And you touched on the economy a little earlier. We've seen with the CARES Act, and now there'll probably be some more legislation coming through, bailout legislation, an increase, quite a potentially large increase in the debt, the national debt. The national debt had been as low as about debt to GDP ratio. Had been as low as about 40% in the 1960s, and had been up around 100% in the Second World War period. And now it's climbing considerably with what we're adding to it in issuing Treasury securities. Now, the Treasury security funding, of course, is being used to help businesses, SMEs, help people with their wages. And that's fine. Those are obviously very important expenditures to make nowadays. But in the long term, in order to do what Dr. Khan was saying in terms of investing more in rural health and rural infrastructure, ultimately some funding is going to need to go to infrastructure development. And here's the economic problem. The higher the debt to GDP ratio, the more that wealth gets benefited and capital gets crowded out. And what I mean by that is wealthy people who then purchase Treasury securities. The upper middle class and the elites benefit, of course, from holding those Treasury securities. But the capital investments can get crowded out for two reasons. One is the immediate expenditures are not on infrastructure. And second, after the crisis has passed, the government is reluctant to add more to the debt to GDP ratio. So it doesn't want to issue more treasuries and thus doesn't want to actually do the expenditures for the hospitals that we're talking about. So there has to be some very astute short and long-term macroeconomic and monetary policy management that works well with our public health infrastructure goals.
Thank you. Yeah. I think we're going to try and do a couple of questions here. Let's see, this is to the whole group. Let's see. What does international pandemic support for developing nations look like when countries that traditionally offer support are struggling with the pandemic's impact on their own health systems and economies? I don't know if you guys can see that to read it.
So unfortunately, I don't know too much about the public international institutional response to the COVID-19 crisis. I do know that the government has taken, some intermediate steps. There are countries that we have sanctions regimes on. If you want to send something to Iran, basically you can't. And so one thing that the US government did was issue a general license to exporters of medical equipment or necessary services to people in Iran if it was coming from the United States. So that's like one small measure. In terms of international institutions and what they're doing, I unfortunately don't have any insight on that.
That's okay.
I will put it bluntly for the audience. Politicization of a public health response to this pandemic and the desperate need to strengthen public health infrastructure does not help. And so if there was ever a time in history, and there hasn't been for the last 100 years, since the 1918 pandemic, where the need was such that we really need to set aside geopolitical calculations and political pressure and deal with this as a public health issue. That may sound naive, but the fact is that nothing short of that is going to help places like sub-Saharan Africa or Southeast Asia or developing countries all over the world in South America deal with this pandemic. Their rudimentary and weak public health infrastructure is buckling under the weight of this pandemic. It was challenged to begin with. It would have struggled to deal with even a limited outbreak like SARS. Now it is challenged to the point that it can no longer sustain itself. We heard the example earlier of India, where millions of people are on the move as a result of migration and forced lockdowns and closures, etc. That is a very real economic situation in many, many other countries. If you consider the area between Pakistan, India, Bangladesh, China, all the way to Indonesia, that's almost 3 billion people together. Unless there is a consortium that comes together through the IMF, through the World Health Organization, through the World Bank to provide assistance, financial assistance, as well as technical aid on ground to shore up public health systems, those countries will suffer a terrible, terrible toll. And that will not strengthen or help the United States. We have to open up our economy at some point in time. We have to open up international travel. We will be vulnerable to the same import of infectious diseases that we were 6 months ago. So it really is serving our interests in terms of sending more aid that way to contain the problem.
I see a lot of nodding heads here. Yeah, that also, that almost raises again the question of China. I mean, what should be the answer to China and China's lack of transparency and the way the markets are now in terms of that we are so hyper dependent on one country?
That is a gazillion-dollar question. I think the vulnerability in our supply chain as far as medical equipment is concerned, and Cody alluded to that beautifully earlier. Those vulnerabilities have existed for the better part of 2 decades, and it was an economic compromise. It was faster, cheaper, easier to manufacture stuff there and import it at 1/4 the price that it would have cost to manufacture it here. That was the simple economic calculation, and all companies, firms made that choice. The US government went along with it. But we did so to a point that we left ourselves vulnerable to the weaknesses in that supply chain, which are now being exposed in all brutality. As far as the transparency on part of the government of China is concerned, that is not something that public health authorities will be able to address. The World Health Organization, once again, is an advisory body. It is obliged to work with all member countries and take at face value what is being presented to them. That is not to say that some really frank conversations don't take place behind closed doors, but it is not the WHO's role to be confrontational or anything less than complimentary in public. And that's been an unfair criticism, once again, being directed for political reasons at our WHO colleagues. The CDC had maintained until recently a presence in China precisely to support and advise on pandemic response and to gather intelligence and share that information with the CDC here at home. That position, as we all know, was eliminated last year as part of a series of economic and other initiatives, supposedly. Okay. That's the price that was placed on public health. My blunt assessment of that is you cannot expect an A+ grade response from a system that is being treated at a D- level.
Thank you.
Good. What happens with China depends on countries outside China and within China itself. Let me explain that. I don't think you're going to see U.S. businesses rush to reinvest or restart up their supply chains rapidly after this pandemic is resolved, partly because we know from economic forecasts that the recovery is going to be much more like a Nike swoosh, that it's going to be slow and long into 2021 and 2022. And then companies are also going to be very conscious of future pandemics, and they don't want to be caught in supply chains that can clog up quickly. So they may want to maintain production facilities in third countries. And so this is why I say the first part of the answer is what happens in those third countries. If you're Thailand, Malaysia, Indonesia, Philippines, Mexico, all countries where pharmaceuticals and medical devices are made, the time has never been better for you to try and attract foreign direct investment in your medical and medical device industry. And that's going to be an issue of policy planning and governance in those third countries. As for the second part of the answer, in China itself, if every time the Chinese leadership is taken to task by European or U.S. leaders, and it views that criticism as sort of fundamentally starting up again the wars of the 18th and 1900s, and an affront to the face of Chinese culture, we're not going to get very far. And so it has to sort of separate some of the ugly rhetoric, which does come from our side, absolutely, from some legitimate criticisms. And they're also going to have to take a long, hard look at how they're treating their own people. Let me give you an example, which I hope never comes to pass. We all know that there are upwards of 1 million Uyghur Muslims in internment camps in China. That's been clearly documented. God forbid that there is an outbreak of the COVID-19 disease in those camps. And that then, of course, that will come to light as the camps have themselves. That will create even more pressure on the Chinese leadership to reform. So that's why I say I think the second part of it is how the Chinese government handles the criticisms and what kind of reforms it makes.
I would also add, Raj, the tremendous weight that China carries in terms of economic investments in Africa and all over Asia are something to behold. And the United States and its allies, as well as Europe, have nowhere near the amount of influence that China does in terms of what they've done on ground. So I would be very, very surprised, if not shocked, if any of those countries decided that they no longer needed Chinese investment or influence. And I almost am willing to bet that as soon as the pandemic subsides, the same sort of dependency type relationship that existed prior to the pandemic will resume with a lot of those countries. And so for that reason, I'm not optimistic that the Thailands and the Vietnams and the Indonesias of this world are going to try and step up and compete with the Chinese anytime soon.
Okay. Cody, did you have anything on that?
Well, that point made me think back to one of the earlier questions was, at what point did we make a mistake in not seeing this coming? And one thing that I have worked on with Raj is that the withdrawal of the TPP was from the TPP by the administration was, to Dr. Khan's point, exactly what the United States was trying to do in building up economic capital against China so that they could play those chips in these sorts of situations in terms of global security and global leadership and coalition building. We have lost that ability to sort of make those economic inroads with those countries and increase their dependency on our economies and build better relations because we have taken this recalcitrant view that focuses on just the United States.
Okay, I'm going to look at another question here. This is more for a local, which is, thank you for this question. It comes from Mark Johnson. Could you compare the actions of the Kansas, Missouri, and Kansas City governments to COVID? What is the trend in the KC area?
I can take a stab at that, Mary. The response locally, both on the Kansas side of state line and the Missouri side of state line, has been very, very positive. Both local governments acted early and acted decisively, and most importantly of all, they listened to their public health leadership on either side. On the Kansas City, Missouri side, I can certainly hold up Mayor Lucas, the Director of Public Health, Dr. Rex Archer, as well as the Jackson County Executive, Frank White, as examples of leaders that came together and decided to implement all the steps necessary to try and stem the tide of the pandemic locally. I think we have avoided the worst possible outcomes precisely because of that early action, even when Missouri as a state was reluctant to act, and still is, by the way. The same sort of decisiveness was seen across the state in the St. Louis City and St. Louis County area, where those municipalities came together and acted very quickly and very decisively. The current situation is that we have passed the peak according to the most recent models. We saw 26 deaths across Missouri on April 14th to 15th, and now it's trending downwards. Fingers crossed, knock on wood, that trend will continue. If all things remain the way they are and we approach June 8th, that's the magical date according to the most recent models, we may be able to look at easing some social distancing guidelines. We will still need to leave in place, of course, instructions for limiting crowd sizes, etc. But the worst might be over by that time. So I'm very proud and delighted with the way the city of Kansas City has reacted to this.
I agree entirely, and just let me add a footnote to that. And maybe this is more of a personal observation, but as you know, our mayor is also a professor at KU Law School. And I have very much admired his willingness to learn from not only other cities, but also other countries. You might remember during the campaign, he talked about how he had studied the city of Baltimore on issues of crime and race relations. And likewise, I know that he has been studying how other countries, Singapore, Korea, Taiwan, have been dealing with the crisis and what lessons can be learned. And I think that's very important for a good leader, which I believe he is, not to have a sort of insularity, but instead, as we would say in the law school, look at comparative examples, comparative legal and policy examples.
Good points. Yeah. Cody, was there anything you wanted to add to that?
Not really. I think one thing that's been interesting is to sort of note how the designation of essential versus non-essential businesses is played out. In Kansas City and St. Louis, it's the categories are relatively the same. Types of businesses identified as being essential, non-essential, what activities they're limited to and not limited to. But as Dr. Khan alluded to, within the state of Missouri, there's no global declaration that really provides the same concrete yes or no list. There's obviously a standing executive order, but it's very broadly worded. It's very lax on actually requiring businesses to do anything. And then the list of businesses that it allows to operate as essential is basically just a reference to the US government's critical infrastructure guidelines, which identifies almost every category of business under the sun that you can make an argument for. So I would just want to echo again that it really has been a lot of the response in Missouri, especially the efforts of city and county leadership that I think has really made a lot of the difference.
Wonderful. Well, thank you. Well, I'd like to thank everyone for tuning in this evening, and thank you to our great panelists. We obviously have your expertise here in Kansas City, and I think we have a lot of great resources with the World Trade Center through the Greater Kansas City Chamber of Commerce and the International Relations Council. So thank you so much to Dr. Khan, to Raj Bhala, and to Cody Wood. And thank you for everyone for tuning in.
Thank you.
Thanks, everybody.